Good afternoon. I'm Dan DeRose with 19 News Now, coming to you from our digital desk. We are minutes away from a news conference being held by the Ohio Department of Health. The state's top doctor, Dr. Bruce Vanderhoff, apparently going to talk about respiratory viruses that are going around in the state of Ohio, as well as pediatric mental health. We haven't heard from Dr. Bruce Vanderhoff in a while. Not sure if this is going to talk about COVID. There has been a steady increase in COVID cases in the state of Ohio. Dr. Bruce Vanderhoff has just taken to the podium. Let's take you live to Columbus.
We have a lot of ground to cover today, but I'd like to start by addressing the latest developments around COVID-19. As you may know, we've seen a modest rise in case numbers over the past few weeks, both nationally and here in Ohio. Of course, all of us in public health are keeping a close eye on this, but it's important to note that these are increases from very low numbers, and that we still are experiencing some of the lowest levels of case numbers since the start of the pandemic. Consider this. 1 year ago, on August 17th, 2022, there had been over 23,000 new cases in the previous week. Last week, there were just under 3,000, 87% fewer than this point last year. And encouragingly, while we have also seen some increase in hospitalizations, the rate of that increase is lower than that of the cases. And again, numbers remain around historically low levels. Also, though they include some new Omicron subvariants, these new cases are still all coming out of the Omicron family. This is what our bivalent boosters are designed to protect us against, and what many of us likely now have as a result of natural or vaccine-based immunity. While this is generally good news, it's also quite clear that COVID isn't gone, and that we really do need to prepare ourselves for the upcoming fall and winter respiratory season, which will undoubtedly include COVID, influenza, and RSV again this year. And the best way for us to protect ourselves from these three respiratory viruses is to keep up to date with the appropriate vaccinations. Now, in terms of COVID, if you haven't received an updated bivalent booster, I encourage you to do so, especially if you are over the age of 60, are immunocompromised, or have serious underlying health conditions. We anticipate an updated booster designed to target the XBB variant that is currently so common will be approved and recommended by the U.S. Food and Drug Administration and the CDC later this fall. And of course, we'll share more information on that as it becomes available. Flu vaccination remains very important as well. And we expect that providers should have a supply of this year's version of the vaccine very soon. Typically, it's available by early September. Finally, we have good news to share about the RSV shot for newborns. Last month, we mentioned it had just been approved by the FDA. That shot now has been recommended by the CDC, and it soon will be available to help combat this serious respiratory virus that we experienced in near record numbers in Ohio last fall, and which nationally is the leading cause of hospitalization in infants under 1 year of age. The CDC will add this shot, the product name is nirsevimab, to the childhood immunization schedule. Their recommendation is that infants born shortly before or during RSV season should get a shot within 1 week of birth. Also, those younger than 8 months who haven't had a shot should get one shortly before RSV season starts. Babies who are between 8 and 19 months of age and have underlying risks that make them more vulnerable to hospitalization, including premature babies with undeveloped lungs, children with cystic fibrosis, those with severely compromised immune systems, they can also get a dose through their second respiratory season per the CDC. The RSV shot for infants could be available by mid-October, and that would be very good timing. And the last bit of good news around this new shot is that it is going to be included in the federal Vaccines for Children program. This means that it will be available free of charge to many children who are uninsured or whose insurance plans may not cover shots or vaccines. And now, to help us better understand the new RSV shot and other recommended childhood immunizations, I want to welcome our first guest, Dr. Michael Forbes, Chief Academic Officer, Akron Children's Hospital. Dr. Forbes, can you share with us, from your perspective, why this RSV shot is so important and why you're confident in its safety?
Sure. Thank you, Dr. Vanderhoff, for the invitation and opportunity to share and talk about this. I do want to spend just a few seconds thanking all the families who participated in the clinical trials that allowed us to get to this point. As a pediatrician and as a pediatric ICU doctor, I have seen the worst versions of RSV, where it's either life-changing, life-threatening, or even resulted in loss of life. And so this is actually a historic moment for us in pediatrics. RSV, as you mentioned, accounts for a lot of the disease that we see, particularly in infants in the first year of life. So we're grateful for the development of nirsevimab and the FDA approval. The vaccine was approved by the FDA after 3 major clinical trials. 2 were safety efficacy focused. 1 was a randomized control trial comparing nirsevimab to palivizumab, which is a drug we've had for over 25 years that helps us reduce the risk of hospitalization due to RSV. All 3 of the studies include safety measurements, and the good news is the safety profile for the drug is very, very favorable. The most common reported safety effects or safety related events were local inflammation at the injection site. A few children did develop rashes. They also developed it in the placebo group, for what it's worth. And there are very rare side effects associated with monoclonal vaccines or monoclonal treatment. Related to a very high sensitivity to the monoclonal antibody, where your immune system either attacks the antibody or your immune system can attack other parts of your body. Very, very, very rare. And I'm aware of 1 report in all of those studies of what's called heparin-induced thrombocytopenia that may or may not be related to the vaccine. So very safe, highly effective. It reduces the chances of, or the risk of a medically attended RSV-related encounter by about 70% overall, and reduces hospitalization by almost 75%. So a real game changer for us in this area.
Dr. Forbes, this is certainly terrific news for children and for the parents of children and the families that love them. But, I think it also highlights just how important childhood vaccinations are generally. Can you tell us a little bit about what other shots kids need and why parents need to really continue making them a priority for preventing diseases that have been a problem for previous generations?
Yeah, no question. I think that for us in pediatrics, we focus on prevention. We will admit that we're a part of a sick care system. The system historically has been developed to focus on what I do and others in critical care and emergency medicine. But the fact is that that's really probably not the way to move forward. And so we focused on prevention. And so we advocate helmets and seatbelts and vaccines. And so the focus on preventing what's preventable is really what this is all about. Before 8 months of life, we expect children to receive really a raft of vaccines, as many parents are aware, including hepatitis B vaccine, pneumococcal vaccine, DTaP, MMR, really a host of vaccines recommended by the AAP. In addition, as we're heading into this, school's about to start or has started for some people, and we're entering into fall and winter, we can't emphasize any more the importance of getting that flu vaccine as well. And finally, as you've already alluded to, I think we have to make sure that we're protected whenever possible against COVID. It's still around. And while for many people, flu and RSV and even COVID can be annoying, a cold, for some people, it is life-changing or life-threatening. So if you can prevent that, I really, really encourage you to just prevent that so you can keep living your life the way you want to.
Thank you so very much, Dr. Forbes.
About.
Well, we talked last month about back to school time rapidly being upon us, and certainly it is upon us now. I want to reiterate some important considerations to make sure your child is safe and healthy as the new school year begins. This includes ensuring they have a safe route to school, that they are wearing a bike helmet if they bike to school, and to check to see that your child's medical information and emergency authorization forms are up to date. I also want to re-emphasize today the importance of keeping an eye out for changes in your child's behavior, changes that may signal that they're struggling emotionally. Because while back to school can be an exciting time for young people, it can also be a time of increased stress and anxiety. Some students may be returning to school with emotionally heavy backpacks. Under Governor DeWine's leadership, Ohio has made children's mental health and wellness a key priority. Supporting our young people and helping every child reach his or her full potential is simply critical. Our colleagues at Mental Health and Addiction Services and other agencies have been working hard to reduce the stigmas and barriers to getting help, making behavioral health services more visible, accessible, and effective. And I'd like to take a few minutes today to explore this issue a bit further. Last month, I mentioned the new 988 crisis line, where anyone can call, text, or chat 988 at any hour and connect with a professional counselor for free and confidential help. But there certainly are more resources than that. And to help us discuss this issue, I want to welcome our second guest now, Dr. Mary Carol Burkhart. She's a pediatrician and associate division director for primary care at Cincinnati Children's Hospital. She's also medical director of the hospital system's Hopple Street Health Center, where she sees patients. Dr. Burkhart, can you share with us some of the warning signs that parents, teachers, and others can look for when it comes to a child's mental health and well-being?
Absolutely. Thanks for having me, and thanks for elevating this really important topic of mental health, especially in our young people. And I like that you had really emphasized change in behavior, because that's really what we want to look for. Changes in behavior where kids are potentially having more temper tantrums, potentially more withdrawn, potentially not able to do the typical things that they once enjoyed doing. And really, it's those changes in behavior that are the signals that we want to look for. Because again, the earlier we intervene when it comes to mental health, the more likely we are to catch kids at an area, at a place in their lives where we can make the most impact by catching them early on.
You know, I mentioned the state's new 988 crisis line. What other resources exist, or what are some of the other places people can turn to for help for a child in need?
There are so many out there. One of my favorite places to go is the American Academy of Pediatrics, or AAP. They have great resources for parents. So if you can even Google AAP mental health resources for parents, those are resources parents can look at trying to help their child first pinpoint and address what their particular child may be struggling with, and gives them lots of helpful hints. That's kind of an early general baseline way to just get more information about the topic. But if you're noticing those changes in your child's baseline behavior, really important to talk to your child's pediatrician or provider. They will have access to local resources. Our schools have also done a great job enhancing the mental health services that they're offering within the schools themselves. And community mental health agencies throughout the state of Ohio are really great connecting kids. The best thing, though, again, is acting early so kids can get help as quickly as possible.
Thank you very much, Dr. Burkhart. Now, before I wrap up today, it's important to note that even though school and football season are starting here in Ohio, we still expect several months of warm weather ahead of us. And that means that mosquitoes and ticks will continue to be active, and both can carry potentially serious diseases. Ticks can carry Lyme disease, which has been increasing in Ohio in recent years, and mosquitoes can carry West Nile virus, among a variety of other viruses. Each year, the Ohio Department of Health partners with local health departments to trap mosquitoes and test them for viruses. The discovery of West Nile virus in mosquitoes this year has attracted some media attention, which is understandable. But it's important to note that on average, more than 900 pools of mosquitoes each year test positive for West Nile virus in Ohio. Fortunately, relatively few people contract this disease each year, 7 last year in all, and none so far this year. But of course, our top concern is to keep people healthy. It's prevention. So we issued a news release in June, which included some prevention and safety tips. We'll post a link to that release in the chat shortly. We also have been posting prevention and safety tips on our ODH social media pages regularly, starting in April and running throughout the summer. This is part of a larger public awareness campaign that includes public service announcements and billboards that will run through September. For more information on ticks, mosquitoes, and our surveillance activities here at the Ohio Department of Health, you can visit our zoonotic disease program page. And again, we'll post that in the chat. Being aware of when and where ticks and mosquitoes are active and taking some simple precautions really can help all of us stay safe and in good health throughout the rest of the summer and into the fall. Thank you. And with that, Ken, I think we can open up to the media for questions.
Okay, thank you, Dr. Vanderhoff. A reminder to please limit yourself to one question. And at this point, our question that we have is from Joe Ingalls of State House News Bureau.
Hello, thanks for doing this today.
Yeah.
Can you hear me okay?
Yes, indeed. Thank you.
Okay, I heard something in the background, so I wasn't sure. So I'm wondering, you know, we've got a lot of kids going back to school, and we know that there are shortages of teachers. We know there are shortages of bus drivers. What about people who can handle health concerns in the schools? Do we have a shortage of school nurses as well? And are you concerned about students going to schools when there might not be enough staff to handle some of the needs that you're talking about here?
Well, thanks for that question. And of course, it has been a priority for Governor DeWine and the Ohio Department of Health now for some time to be working to increase the resources that are available to our children related to all kinds of issues of health. And so, we are making further investments, for example, in the school nursing programs, and we're making investments in visitation programs and a whole variety of efforts. But at the end of the day, it really requires all of us to be attentive to children and their emotional and behavioral needs, as well as their physical needs. So while we place great emphasis on things like vaccines and safety going to and from school, it's part of the reason we're highlighting today the importance of all of us being observant for changes in our children's behavior, and then reaching out to resources. Those resources can include, of course, their primary care provider, the 988 line that we've talked about, and of course, the professionals who work with them every day at school. Let me turn to Dr. Burkhart. Dr. Burkhart, is there anything that you would add to that?
The only thing I would add is just the importance of parents in this. Parenting is obviously a hard job, and parents being aware of what's going on with their kids, I think, is super important. There may or may not be school nurses, depending on where a child goes, but parents paying attention to what their kids need so that they can escalate that to whatever resource and professional is needed, whether it be the pediatrician, a mental health professional, or someone else, based on learning needs that their child may have. So just want to give a shout out to the hard job that parents have, and ask parents to stay attentive to their kids, especially during the times of transition, which back to school always is.
Okay, well, we have no other questions, so we want to thank you again today for joining us. And Dr. Vanderhoff, do you have any closing remarks?
Well, thank you again for joining us, and thank you to my guests for the wonderful messages that you've shared. We have a number of important resources that are so important for all of our health, but especially for our children's health, as now we are beginning yet another school year. Hope that we'll carry the message about the importance of the vaccines and the new vaccines that are becoming available for protecting our children, as well as our messages about our children's overall safety and inclusive of their emotional and health and their behavioral health. So with that, thank you very much, and we'll look forward to seeing you the next time.
Dan DeRosa with 19 News as Dr. Bruce Vanderhoff wraps up his news conference, giving a brief update on COVID. Yes, our numbers are increasing, but we are still at historic lows. Doesn't sound to be, doesn't exactly sound the alarm that they're anywhere near, but they're following it, they're tracking it. The next message was about the RSV vaccine being approved for infants. And you heard from the doctor from the Akron Children's Hospital, Dr. Michael Forbes, say that this is a major breakthrough, that he has seen RSV and what it can do to infants. It's a respiratory disease. Infants and small children, their lungs are not as developed as older adults are. And when they get into that respiratory illness, it contracts into their lungs, and that's where they get into dire situations. Dr. Forbes saying even death. So the fact that infants are now approved for an RSV vaccine, very important. Then the third topic, really mental health. As the school year starts, we heard from the doctor from the Cincinnati Children's Hospital saying parents really need to be aware of a change in behavior. Mentally, Dr. Bruce Vanderhoff described it as a mentally heavy backpack as kids head back to school. He reiterated the new crisis line, 988. That is for anyone to call at any time of day, 24 hours a day, to deal with crisis and mental health and to get further resources. We're going to wrap this up. Remember, our noon news includes our first alert weather. We are in a first alert weather day, so you're going to want to make sure you tune in as we look. And I can even show you the radar here as storms start to move into the west side of the state of Ohio. We will have much more on our noon news, and when we start 3.5 hours of news at 3 o'clock. Until then, I'm Dan DeRosa with 19 News Now. Have a good afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media at Cleveland 19 News.